Hello, friends. So glad you have tuned in today. Man, you're in for a real treat this week. We have in the office. I'm used to seeing him in his office, Dr. Bill Cox. Hello, Doc. How you doing today?
Doing well, thank you.
So glad you're here today. You and my family, we go about a lifetime back.
Yes.
So tell us about your family.
So my wife Bianca, who you've known since you've known her since before I did.
Yeah, since she was a teenager, man.
That's right. So I'm married to Bianca, and we have two kids. Christopher, who just turned 27, and Emily is about to turn 26.
Wow. Okay, I did not realize he's older than she is. I didn't know.
Yeah.
Wow.
So Christopher is working on is getting ready for a certification exam to help adults on the autistic spectrum. So he's getting certified to do that. And our daughter is a registered nurse at UT Southwestern, and she's taking prerequisites to apply to a physician's assistant school. So, and we're hoping that she'll wind up at UT Southwestern for that program, because that way she'll stay close to home. So, and then we have in-laws everywhere from Lipan to Missouri to Dallas to all over the place. So, but that's my immediate family. So
I met Bianca. She was a teenager in our church. How did you meet Bianca?
So in 1993, I was graduating medical school, and she was moving from one hospital to another. She's a registered nurse, and she had an opportunity to take a nursing position at Methodist Medical Center in Dallas, which happened to be where on July 1st, 1993, I started my residency. And so a few months later, sometime in the fall, we had run into each other a little bit, because she had gone on to take over the oncology unit. And so whenever I would have a patient up there, we'd run into each other. And then I think it was that Christmas Eve, I was on call and she was working. So we were both there that evening. And so we just got to talking, and that's how we first got to know each other. And Bianca had the reputation of, among the residents, of, if you've got a really sick patient, send them to Bianca's floor and send them to Bianca. Because at that time, for example, if a diabetic had a condition called DKA, which is really dangerous, this was back in the old days. I know our chief resident, who was extremely particular, only would let Bianca handle his DKAs, because she was very thorough, very detail-oriented. She was very serious. So, and then we started dating, and it was in December of my second year December of my third year, we got engaged. And then that May, we got married. And then between that May and September, we got married, we bought a house, we moved, we started practice. So it was a very busy few months. So, but that's how we met and got married.
So let's go back a little bit. What made you decide to be a doctor? How is it?
So when growing up as a small child, I was around my grandparents a lot, all four of them. And a lot of them had health problems, and my mother had a lot of health problems. So I was around doctors' offices, and to the point that they would allow a small kid, I was around hospitals a lot. And it was really, really fascinating to me. Everything about, what was wrong with this person and what the doctors were doing, it seemed all mysterious and exciting and all that, especially to a little kid. And so when I was 5, I just decided I think that's what I want to do. So from there on out, that's what I wanted to do. And unfortunately for my family, lots of close relatives, grandparents, and my mom continued to have health problems throughout the rest of their lives. So there was continued exposure to healthcare over and over again. And I didn't like the fact that my relatives were sick, but being around healthcare, it was a really neat place to be. It was a really interesting place to be. So, and then as you go further along, you kind of decide what field you'd like to go into. And then one of the things about internal medicine is it is so broad and so huge, you'll never master it. And so, but there's kind of an appeal to that because you'll always have new things to learn. You'll never get bored. You'll never know it all. So you'll always have new things to learn, and it's constantly changing. I can't keep up with all the new biologic drugs that are coming out, which are amazing. So it's just this huge field of knowledge that's really appealing.
So you talk about changing. Okay, you've been a doctor for, I'm going to do the math, 32 years?
Yeah.
How has it changed in the last 32 years?
So some things have been really great because some treatments we have today we couldn't have imagined when I was in residency. It's amazing. However, for example, when the idea of the electronic medical record first came out, I thought this is such a great idea because it was always hard. If you were seeing a hospital patient, you'd have to go downstairs to medical records, sit there while they pull this huge paper chart, and then thumb through it to find what you needed. Well, I thought, hey, if everything's on a computer, all you had to do is hit the right button and you'll find the EKG or the lab work or whatever it is you need. That's great. It'll be a great tool for doctors, nurses, therapists, everybody. Well, the powers that be, I guess, seemed to take that tool, which was a great idea, and turn it into a way to kind of manage and analyze healthcare. And instead of us just sort of doing what we thought was appropriate in putting down the information, they said, no. Even though we're not doctors or nurses or physical therapists, this is how you're going to enter the information. You're going to put it in this box, and this box, and this box, which didn't make any sense to us. And so that's one change in which it's great that we have easy access to information for our patients, but it kind of got twisted in a way that makes it cumbersome and takes time away from the patient. And a lot of other changes just in the economics of healthcare have taken away a lot of time with patients. For example, in regular primary care practice, if you're seeing somebody for their general checkup, you maybe have a lot of doctors, I should say, maybe have 15 or 20 minutes to do a comprehensive exam and deal with whatever other problems they might be having. That's just not enough time. Especially when so much of your time you're kind of stuck on this keyboard entering in data in a very non-intuitive way. And then we have failed to, in spite of the fact that since I was in college and before, we knew that access to healthcare was a problem. Since the 1970s, 1980s, we've known that, we've got to figure out some better way to make sure that everybody gets the healthcare they need without breaking the bank. And even though we've had decades and decades to do that, we're still such a long way from that. And so there are so many people who they either go broke paying for their health care or they just don't get health care at all. And that's one way in which we've really failed. There's got to be a better way, but we haven't gotten there yet.
What about all the changes in drugs?
So the good, I think, has been that we have fantastic new treatments that are making a big difference in patients with things like autoimmune disease. Even in patients with things like Alzheimer's disease, there are some new drugs that are doing things we never imagined. However, the cost of these drugs has become, we would have never even thought of a dose of a medicine costing $16,000 when I was in training. I mean, it was unthinkable. And I know that cost gets adjusted and the insurance company negotiates a lower price, but still the idea that one infusion of a drug is going to cost many, many thousands of dollars. And I know it costs a lot of money to develop those drugs, but I just hope that what the pharmaceutical companies are doing is being reasonably fair in making a reasonable profit on what they're doing and not just sort of gouging the system because, again, we've got wonderful new medicines, but the cost is just unreal. So, and that's where things are kind of another area in which things are out of balance.
Yeah, it was when Obamacare first was introduced. I had really high hopes for equality on medical care. And I even had higher hopes of, and I don't know how you do this, but and I hate to use this word, but I'm going to use it anyway, control. There'll be some kind of control so that even though you have a product that everybody needs, you don't get to charge whatever you can because out of desperation, people will pay that.
Yeah.
So, and I don't think social medicine is the answer either. I hear a lot of the younger generation saying they want social medicine, but if you actually study social medicine outside the United States, it's not what you think. It's not what you think it's going to be. You know. So, but if you were, if someone was to talk to you and they were considering going into the medical field, what would you tell them today?
So, I got a good. I didn't make this up, but I'm going to quote it. I would tell them, if that's the only thing you can do with your life, then do it. If there's anything else that you can, in your life, that you can foresee yourself being fulfilled in, do that instead. But if this is all you can do with your life, then do it. So
you sound like a pastor now. Better make sure it's God, right?
I mean, and that's the way I felt because when I was in medical school, there was this. I just had this horrible fear of, oh my God, what am I going to do if I don't make it through this?
Yeah.
I just can't imagine. I just can't imagine not doing this. But I think it's reached a point where, because there's constant change that no one can keep up with. Not the good change like the scientific advances.
Yeah.
That's great. It's great that we would have to struggle to keep up with that. But constant change in terms of the rules change from one year to another. And the respect for healthcare workers declines over time. So if that's the only thing you can do, then pursue it with all your heart.
Yeah. You were very instrumental in helping with Barbara. And I'll never forget that.
It's a privilege to do it.
Tough time.
Yes.
Tough time. And it took a long time for them to diagnose Barbara. And part of it was, and I don't say this bragging, she's just really, really smart. So when she's taking the test, she's still passing. And I kept telling him, I said, you don't understand, this lady's brilliant, and this is not normal for her.
Yeah.
So we were even considering going to Houston to get help, and you said a couple of things to me that were they were life changers for me. One was they've already run every test there is to run on Barbara a couple of times, and the results are the same. And it says, as doctors, we think we can fix everybody. It's not necessarily the case, though. And he says, you can, if we wanted to go to Houston, then you would write the letter, and we could go. And so far, I was okay with that conversation. But the next statement that you made was, sometimes you need to think about quality of life. Just as you're in love with the love of your life, Bianca, I was and still am with the love of my life, Barbara. And so the thought of this is probably not going to end the way you thought it was going to. It's very difficult to deal with. And but I heard what you said, and it did change my thinking. Okay, we need to figure out how we're going to wrap this up, So there are other people out there today that they're in the same position that we were in, tried everything, nothing's working. What would be your admonition to them today if they're at that point where I was at, there's not any help. Medicines, there's not any medical solution to your problem. What would be your advice to them today? If
you reach a point where you and your doctors feel like any further investigation, any further testing is just going to sort of be uncomfortable, but not add to anything, no realistic chance that it's going to add any help or make anything better, then I think that's when you do focus on quality of life. I think that you need, and I think everyone needs to get to that point where they can believe that, where they can feel convinced that, yes, based on what I'm seeing, based on what the doctors are saying, I believe that, and I'm comfortable with that. And then you do focus on quality of life and quality of the time you have, because that's extremely precious.
Yeah. It does change the way you start dealing with life every day. You're not out there trying to find an answer when there may not be an answer out there. And you start figuring out, okay, this is the time that we have. How do we live this out? Tough conversation.
It always is.
But I'm very grateful because it was a turning point for us. It's not like, and you knew this, we didn't. The hard days, they hadn't even hit us yet, Yeah, we were still at the what's going on stage, Now the good news is that there's all kinds of good news. The neurologist that you connected us with, she was phenomenal. The first time she met Barbara, she says, dementia. And yes, that's what she has, And then was very, very helpful, even with the hospice when they came in. And it was a good turning point. And there are people out there today that they need to hear that, just like I needed to hear that. They need to hear it too. Well, you're not just our doctor. You're my friend.
I appreciate that.
And I'm very grateful for that. And you and Bianca continue to be kind to me. I don't know why, but I'm grateful for that. But you're also a partner. You partner with us at Metro. You know of our need. The dream the Lord's given to us to build these brand new facilities and to do it debt-free. Why should people partner with us today and believe us for this miracle?
I can think of a lot of reasons. You serve primarily the southern sector. I'm from my whole family's from the southern sector, and I was fortunate in that I never had to struggle as far as just having the things I needed, but. We knew that there were vast numbers of people there who were struggling, whether it was southern Dallas or even in some of the southern suburbs, who were struggling, and these people deserve the same chance anybody else would have. Resources like Dallas Metro, we know that they make a difference for young people. And I think that if you can shape young people through showing that someone cares about them, showing them that God cares about them, if you can shape them at an early age, you can point them in the right direction. Because if one of your kids says, I want to be a lawyer, I want to be an engineer, I want to be a doctor, I want to be whatever, and that's just where my heart is set, they should never, ever think that, well, I've got a lot of disadvantages, so I shouldn't even think about that. They should never think that. And I think that with programs like Dallas Metro, that provides so much guidance and inspiration, and that makes the difference between a kid who should go on to, develop the next spaceship, versus that same kid going on to work at 7-Eleven, because that kid's got the capability of doing it. So that's why that organization needs to continue thriving.
Yeah. You said two things that struck a chord with me. One was that they deserve a chance. I firmly believe that. I got a chance. Mm-hmm. You got a chance.
Yep.
And as a result of that, look what the Lord has done in both our lives. Everybody deserves a chance. Mm-hmm. Doesn't matter where you live. And the second part is most of our kids don't have dreams. Their dream is survival. Not. If we've done anything, we've told them that when God sees them, He sees value. Not somebody that lives wherever, was born into whatever family. They have value, and God's got a plan for life. And the result of that is that we do have kids that are lawyers. We have kids that are teachers, which is kind of ironic since DISD's not ranked real high as far as schools in the state of Texas. And in spite of that, the Lord it's amazing what the Lord has done in these kids' lives. And, hey, I really appreciate you being here today, Bill.
It's my pleasure and my privilege.
Thank you for your friendship.
And for yours.
Appreciate you coming by today. Thank you for taking care of me.
I hope to continue to do so for a long time.
Thank you, friend.
My pleasure. My pleasure.
Hey, I'm so glad you chose it. Wasn't it cool? Don't you wish you had a doctor like that in your life, right? You know what? I believe that God's got a special doctor for you. If you don't have one, Dr. Bill Cox, and he's actually listed as Dr. William Cox. He'd be an awesome man of God to have in your life. Our kids need a chance. He talked about that. I believe the Lord will provide for them a chance. And just as He'll provide for them a chance, I believe that He's going to provide a chance for them to have a home church, a facility where they can come every week, grow in the Lord, a place that'll be not just a place of intake, but a place of outgoing. And we're going to see change take place. We already have. The Lord's already raised up this new generation of leaders. We just need to equip them not only to do the daily ministry out on the streets, but equip them to bring these families in and grow them in the Lord. Would you go to our webpage today, dallasmetro.org, click on All In, click on What is All In, and then would you prayerfully consider making a donation today? We need your help, folks. The city has our plans. As soon as we have approval from them and we have the money in the bank, then we're going to start, and you're going to see God do a big miracle. But it's going to happen because you respond today. Thanks for watching today. Hope you have a great week. See you next week. God bless you. Bye-bye.